Swayam Prabha. Digital India. Educated India.
First of all, let me thank the organizers of this national seminar, Department of Music from University of Hyderabad. I am Dr. Fanindra. I am Emeritus Professor of ENT from NTR University of Health Sciences. I am the voice surgeon. I am now not an ENT, I am specialized in voice surgery and care of professional voice. That is my specialization. I start with Endaro Mahanbhavulu, Andarki Vandanamulu. That is my first presentation. In the beginning, I want to start with all the people. There are so many people. The singers will touch the hearts of the people. And singers are the top one professional voice users in the society. Of course, this is only general copyright about our videos and other things. Now, there is one saying that human voice is the most beautiful instrument of all, but it is most difficult to play. Most difficult to play. And human voice is the only living instrument of music. It is a living instrument of music. But everybody must know. Then, I would like to stress certain important issues about the human voice. What are the interesting aspects? When compared to other species on the earth, human voice has a very complex mechanism with the capacity to modulate itself to express different feelings like anger, happiness, comments, intimacy, frustration, and whatnot. Please remember, it is possible only in human beings, not any other species on the earth, because of a unique structure in the vocal cords called vocal ligament. In the vocal cord structure of human beings, there is one elastic structure that is created, meant for a human being by God. Maybe God gifted the human beings that stretches according to the pitch, that stretches in different frequencies and different pitch and frequencies for intensities that will change. So this will be there. But the interesting aspect, another thing is, this vocal ligament is not fully developed in children. That is why you find in children, they have what is called a mono pitch, only one pitch. They have always a high pitched voice in children, you find. Up to the age of, say, some 15 years or 14 years. But once they reach adolescence, puberty, the change starts in males, not much in females. This is because of the hormonal changes as well as in the structure of the larynx. There will be changes will start. So, experiments on human voice is possible only on human beings, because who can't do any other species. That is another problem here. Who can't do any other species because it is unique. We don't have any other source to do experiments on the voice, except on the human being itself. Now, the interesting aspect, how to look at your vocal cords and who did it first in the world. Very interesting for you, I am telling you. The instrument we use for looking at the vocal cords, we call it the laryngoscope nowadays. And your vocal cords are placed 12 centimeters deep from the level of your teeth in the throat. From the teeth, they are a distance of 12 centimeters deep, at depth in the throat. So how can you look at it? Please remember, the first vocal cords were seen or directed or by musician in the world, not by scientist or a doctor. He is a singer. He is a singer. It must be very interesting for you. He is not the doctor or scientist. Who is that singer? In 1855, a career vocal coach and a professional French musician called Manuel Garcia, while he passing through the streets of Paris, he was playing violin and he found his violin image in the ventilators, glasses of the buildings. Then he got an idea immediately. Can I see the vocal cords like this? So he threw out the violin there, rushed to the house and take a mirror, ordinary mirror, and asked somebody to come and put the mirror into the throat. See? He has just put the mirror into the throat. Then he saw the vocal cords. Then you say, vocal cords started moving. Then he ran to the streets. I saw the vocal cords, I have seen the vocal cords, I have seen the vocal cords. So it is the musician, not a surgeon, or a scientist, or a physician. So that has become the standard of examination in ENT. Even today, you find if you go to ENT clinics, the ENT surgeon will put a mirror into the throat and see you with a headlight and see in the mirror. That is an indirect image. That is called indirect laryngoscopy. We do indirect laryngoscopy. Of course, that is a traditional examination of the vocal cords, examine the vocal cords. So you can find here the picture here, you find how the ENT surgeon will examine the vocal cords. And here you find the Manuel Garcia here. This person, this gentleman, the great man, who has seen first time described how can you see the vocal cords. That is very interesting. Human voice is unique for each individual like a fingerprint. Please remember, you cannot have a same voice to any person similarly. It is like a fingerprint. You may do some mimicry, you may do something like that, but it cannot be same. It cannot be same. That's why it is also used to detect criminals in the society. The fingers, the voice identity. Vocal cords also vibrate, interestingly, at the rate of 300 times per second when you are speaking and 1000 times per second when you are singing. 1000 times the speed. See, so it is very difficult to see the vocal cords with ordinary endoscopes or ordinary instruments because they just go on vibrate very fast, very fast. And here I show the latest technology where you can see the vibration of vocal cords. Here, see, you can see the vibration of vocal cords. See, you find like a waves of emotion. That is, we call it as mucosal waves on the vocal folds. You find them waves of motion on the vocal cords levels. So these are called mucosal waves. They are giving the sound. So, and everybody now talking. That is very common thing. In our system we call raga gnana, tala gnana. వీడికి రాగజ్ఞానం లేదండి, తాళజ్ఞానం చెప్పలేసి వస్తున్నా వీడికి ఎక్కట్లేదు అంటారు. చెప్పలేకపోతున్నాం సంగీతం వీడికి ఎక్కట్లేదు, ఎంత చెప్పినా వీడికి రాదు, పాపం క్యాచ్ చేయలేకపోతున్నాడు. ఎస్, దట్ ఈస్ రైట్. రీసెంట్లీ scientists found there is a singing area in the brain. Till now there is only speaking area. Only recently scientists found. Usually the speaking area on the left side of the brain in right-handed persons and in right side in the left-handed persons. Now in the opposite side they found the singing area. So the people who got a well-developed singing area, they have the best capacity to learn singing. So you find your disciples, why some people not able to do something? And genetically, it runs in families. It runs in families. In families, oh, entire family are musicians, this and why? Only because of this. This is the secret of science of singing. Now, singers are top 1 professional voice users. Minimum deviation in their voice may endanger their life because that is bread and butter. For a singer, bread and butter. If they don't have voice for one day, finish. So, that is very, very important. There are other professional voice users also, like apart from singers, you got lawyers, you got teachers, lecturers, dubbing artists, politicians, because they run after me during elections. Sir, I lost the voice, please. Unless I give something for you can't give speeches. So politicians, so that is also very, very important. They have very, very important voice, very, very important for them. Business people, and nowadays communications, voice very important for IT. Your communication has a lot of importance. So I get number of males come to me with female voice. They are not communicate. They are very intelligent that fellow. So I change them to male voice. When it comes to me, female voice, I change back to male voice and them back. So he goes, I happily got the job, promoted. Now, research has shown that perhaps more than 2% of the world's population perhaps less than 2% of the world's population physically unable to sing. That means 98% of the population can sing. Either they may sing in the bathroom or sing on the stage, doesn't matter. They can sing. So there are 98% singers in the world. Yes, they have the capacity, but not art of singing. What you are doing is art of singing. They are also singing, but you know the art of singing. That is the difference. That is only the difference. Now, the process of bringing the voice under control, using the whole body as a musical instrument with modulation, breath control, effective pronunciation, known as voice culture, that many people have been seeing since morning. There are a lot of discussions on voice culture. I learned so many things today. When doctor is speaking, I was learning so many things. But I don't understand certain terminology. They were calling sometimes thin voice, thick voice, and hollow voice. That we don't have the terminology here. And we don't have we don't know what the terminology, we don't know that musical knowledge. Maybe we are lacking in that musical knowledge. So a singer has to exercise their vocal cords to bring them under command of musical impulses of the brain. That is we call it as sadhana or riyaz in your terms. So ultimately it is the brain, not the vocal cords. Entire body, Kalpana telling, entire body is important. It is not the voice. So when the person come to us, either maybe a singer or a patient with voice disorder come to me, I examine the entire patient, not the voice. Starting from his doorstep, the approach is entering this doorstep, and how he sits, how he took, how his face looks, everything, because the psychology has got a lot of role in voice production, psychology. The gestures, how he is making gestures, that is very, very important. So unfortunately in India it is not a science still. It is all art. Because I started this specialty 20 years before with the great Balasubramanian Garu, who inaugurated my clinic, voice clinic. This is the Melody Voice Clinic, the first voice clinic in India, first voice clinic for professional voice subjects. Why it is not a science? People are not aware because nobody telling it that it is a science, you must know about this. So what happens if you go to general ENT clinics? What they say? You give rest to the voice. Don't sing. Give rest to the voice for 10 days, 1 month, 2 months, 3 months. What happened to singer? A professional singer, a teacher, singing teacher, what to do with him? So, the knowledge of technique of singing is much better in classical singers than in amateur singers. That is a well-known fact. The technique of singing is much better with classical singers because they have methodical techniques, what they do. Now, the mechanism of voice production during singing, that is very, very important. Every singer must know about this. It is not the vocal cords for singing, it is vocal tract. It is vocal tract, not to sing. So, what is this vocal tract? It starts from your lungs to the lips. Lungs to lips. The vocal cord starts from the lungs to the lips. So, how this mechanism of voice will start? It starts with voice activation. Activation that is done by respiratory system. That is the lungs, lungs, diaphragm, the chest, the abdominal musculature, the chest musculature. These are very, very important. So, in the first phase of voice production, what is happening, we will see here. Once the air is pushed, so you can see here, once this air starts pushing the vocal cords from below like this. I don't know whether you can see here. Yes, sir. Yes, sir. This picture is not good, the screen. Maybe that side you can see that. See, the air is pushing the vocal folds from below. This is called air pressure. I will compare this to harmonium. I compare this to harmonium. When there is bellows, there are bellows. Here also bellows are lungs here. For human beings, the bellows are the lungs. And vocal cords are the reeds. Reeds of piano or harmonium, what do you call it? So this is very important. For harmonium, the bellows are important. So here also, the shots, that is called voice activation. This is very important for intensity of voice or volume of voice. If these things are perfectly maintained, you can maintain good intensity. If you don't maintain good intensity, the melody automatically will come down. No, intensity very important. Intensity at perfect levels. That is very important. Next step is called voice generation. How the voice, first preliminary the voice is produced. This is done at the level of the vocal folds or vocal cords. Actually, vocal cords is not a correct term, but even though it is a common term, it is not a cord-like structure, hard structure. It is very fold, it is mucosal fold only. So the correct term is terminology vocal folds. But both are used. But technically talking, it is only just very thin vocal folds, very thin. See, they will be so thin, they will vibrate like this. And another thing is, the larynx has given two functions in the body by the God. The larynx, not only the vocal cords, it is also entry for your breathing. The entry gate for breathing is from the larynx, the vocal cords. So you see how the vocal cords have double action. You can see here, when they are speaking or talking, the vocal cords come closer. See, you can see, just watch. See, here they are coming closer like this. When they breathe, they go back. So, and separate. So when you are singing, breathing, they go away. When you again start singing, they come very closer. Start vibrating. So this is within seconds. Otherwise you can't breathe. Because it is going through the same path. Which is very, very important. So breathing has got very important. That is why the breathing has got, this is the very, very interesting aspect, because in the body, there is only one organ in the body which has got opposite action, the same place. Going back. In the body, for every system in the body, there are two different nerves. For turning like this one nerve, turning like another nerve. But here only one nerve from the brain controls both these antagonist actions, opposite actions. That is the basic, the peculiarity special of the vocal cords of the human being. Nothing. So it is antagonist action. So now again we will see here what is happening. This is called this stroboscopy. So this is called dynamic endoscopy. That means when the patient is singing or speaking, we will see directly the vocal cords. And this is also, of course, I will next tell you what is the importance of everything. So here also you find when they are phonating, they are vibrating like waves on a ocean, the mucosal waves. Once you start breathing, they are going apart. This is the live. So this vibration vocal cords responsible for pitch or frequency. First lungs intensity, vocal cords only pitch or frequency. So that is up to vocal cord level, that is the only function. Entire voice is not from the vocal cords. It is the resonators. And which are the beautification of or melody of your voice, not from the vocal cord, it is only from the resonator. Vocal cords only 50%. Remaining part is taken by the resonators, resonance system. What are these resonance systems? Your body build, your body structure, your thoracic cage, your walls of your throat, the walls in the throat, how shallow it is, how narrow it is. Okay? The soft palate, lips, tongue, lower jaw, movements of lower jaw. Next come the sinuses. They are responsible for timbre, quality or melody of the voice. So this is the vocal tract coming like this. It is, and it comes the vocal cords here. So the voice in speech production, the voice shorted here, going like this, it gets modulations here. Modulated. The resonance, everything will be added. Ultimately, the coordination for the brain and nervous system. If you have good control on your brain, you have good control on voice. If you are peaceful, your voice is beautiful. If you are agitating, tense, it cannot be. Because the impulse has come from there. If you are very tense, when you were very tense, what is happening? Your entire body becomes tense. Please remember, the vocal muscles also become tense. Vocal muscles also become tense. So, relaxation. That is the most important thing. Now, the average length of the vocal tract in males is about 17 centimeters and 14 centimeters in males, and it is about 14 centimeters in females. Now, this video shows interestingly different pitches, how the vocal cords will choose different positions, how they change the position. You can see here. I don't know if you can appreciate it or not. So, somebody is singing at bass level, somebody in different pitches, and how the vocal cords they are acting, how they modulate. This is the gift of God to human beings, that's what I tell you. No other species on the earth, no other species, who are grateful to the Almighty and the God. Now, what is the difference between ENT clinic and a voice clinic? All ENT clinics are not voice clinics, please remember. They are not, because there are, now I started the specialty in the country 20 years before. So I brought this to country, first time to India. And now I started, after that I trained some people in Mumbai, I taught some people on the Institute of Medical Science in Delhi, trained them, and Bombay. They are there. Now we are only 5 voice surgeons in India, 5, only 5. So first is started in our combined Andhra Pradesh in Hyderabad. That was the first voice clinic in India. So what is the difference? These voice clinics will have a team of voice specialists with the ability to understand the language and problem of singers. You are telling gamakas, you are telling ragas, and you are telling, I'm not able to reach the pitch, my voice breaks. Na shruti andatledandi, break అయిపోతుంది. వాడికి శృతి అంటే తెలియాలి డాక్టర్గా, తెలియకపోతే ఏం చేయలేదు అక్కడ. సో ఇఫ్ యూ గో టు జనరల్ ఏంటి డాక్టర్ పిచ్చెక్కిపోతున్నాడు, ఇది చెప్తున్నాడు, ఏంది అర్థం కాదు. అప్పుడు ఏం చెప్తారు, సార్ మీరు కొన్నాళ్ళు ఈ ప్రొఫెషన్ మానేసి చూడండి ఎట్టుందా అంటాడు మిమ్మల్ని. సో దే సే యూ టేక్ రెస్ట్ ఫర్ సమ్ టైమ్ 3-4 weeks, give voice rest, and then if not possible, better quit this profession. What is the use? What is the fate of that fellow? And a renowned singer, if he starts singing, what is the fate of him and what is the fate of the society? You are making so much fun and happiness to society by your songs, singing. So many people are enjoying, but what is their fate? So that is the difference between an ENT clinic and a specialized voice clinic. And the special instrumentation for the diagnosis of the voice problems will be there in the voice clinic. See, if you go to general ENT clinics, they do endoscopy. That is called videolaryngoscopy. That is not actually for voice. Actually, that is just the examination of vocal cords. That is called videolaryngoscopy. They put an endoscope and then see. But there are special instruments for voice, actually called as stroboscopy. That is a videolaryngoscopy, where the vocal cords movements are shown in a slow motion. Slow motion. Because I told you vocal cords vibrate at the frequency of 300 times per second and 1000 times while singing. You cannot see them such a fast movement in ordinary endoscope, not possible. So I will show you how it look, how does a stroboscope look present like this. See, this see, it slowly moving, the vibrations. The flashes of light show the vibrations are shown like this. See, that vibrations cannot be seen by ordinary endoscope. Only this, you need this special instrument called stroboscope. The strobe light will create a slow motion picture and show you. And this, of course, this is one patient has a problem with came with hoarse voice. He has some mass, something like that. That is different. The next thing is what is called, we do in voice clinic, singing endoscopy. In singing endoscopy, what is, we'll pass very small fiber light through the nose. It is not through the throat, because if you put it in the throat, you cannot sing. Small thread-like thing will go through the nose and ask the patient to sing. So we'll see, at the time of singing, we can judge whether there are any defects in your vocal fold levels or your pattern of singing. All this you can check out. So one example I show here is the one such like that. See. So this is called visual training to the singer, because when a singer has a problem, we play to him and show him. So if you sing like this, your vocal cords will be like this. And if you sing like this, you change your pattern of singing, your vocal cords will be like this. So now you understand how to maintain your singing work. So this is called the singing endoscopy. And more that we got still advanced techniques called as singing stroboscopy. You can find also here. The other video.
తెలవారదేమో స్వామి నీ తలపుల మునుకలో అలసిన దేవేరి అలమేలు మంగకు.
See, his voice is breaking at this level. So you can find there is a nodule here. See, now we made a nodule. That is not detectable by other endoscopes. Not endoscope. So when you go to general clinic, they may say, they do their best, but they say, they say there is nothing, don't worry, give voice rest and then we stay for some time like that. So that is how there is this, because once the specialization has come, see, sometime before this urology, gastrology, everything done by general surgeon. Then a lot of specialization, higher specialization. This also like similarly same. The next aspect is computerized voice and all. Somebody asking the parameters. What is the parameter? See, the singer will come and tell me, sir, my voice brahmanangam paarthan sir undedi. Chala baaguntundi na voice. My voice is excellent. Some singer come. Then I ask him, what is that baagundatam? What is that excellent mean? What does it mean? Can you explain to me? Can you explain? What is that good voice? Can you explain to me? You say, it's excellent voice, sir. I used to sing like this, like that. Can you explain? Because there is no additive for voice. You cannot measure the voice. How? Now the technology is this. You not only hear the voice, but you can see the voice also. You can see the voice on the computers. So where you can see these harmonics as well noise levels. The spectrograms, voice spectrograms who have, with voice spectrograms you will see the noise levels and also the harmonics. If the noise levels are coming down, means your voice is technically improving. So this is useful not only for your treatment or for documentation for us. When a singer come to single clinics, we'll have all this documentation. We record every patient voice, patient or singer voice before and after treatment. Before, just like you go for a facial plastic surgery, a plastic surgeon, they take photographs of your nose, face, everything, different angles, and they operate. And after that, how is the face now? Are you happy? Then, if you are not happy, some more sculpture. Again, we do no more operation. No problem. So until you are happy, you operate. So that is the facial plastic surgery. Here also, in voice also, we treat the patient until he satisfies, and also we also have to satisfy the doctor. And another thing, other aspects of treatment in medical field is different here. The voice of patient means not only must be happy to the patient, but others also. Because others also hearing his voice. So others must come and tell him his voice is now good. Then only he feels happy. Otherwise, sir, something wrong. So we record the voice, and every stage of treatment will make him to hear. See, at this level your voice is like this. Now I treated you, see this. Suppose you want some more correction, we will do something for you. So the recordings will be there. This is a compulsory, absolute recordings will be there in the voice clinics. So whenever you touch the voice patient, without recording, you don't touch the voice patient. So these things are of help for documentation purpose.
SwayamPrabha. Digital India. Educated India.
What are the common problems of singers? First thing is hoarse voice, a rough voice. Common cause is sometimes cold, maybe ordinary cold. Singer's nodules, this is very important, and vocal polyps. What is the singer's nodules? Why they are called singer's nodules? Actually, they are called vocal nodules, Because they are common in singers, they are called singers nodules. Nodules means small pill-like structures which start over the edge of the vocal folds and inhibit their vibration. So it looks like this actually. See, when it is vibrating, see, this is the nodule. Why it occurs? Please note, it is the faulty voice usage. Many people say that it's not the how much time you use your voice. You may talk for hours together. You give lectures, sing, whatever. Use it perfectly. That is very important. Use it perfectly. You must know how to use your voice. Then what happens, if vocal cords will vibrate, they rub each other like this. Every time they go on touching each other. Unless you take see, you can see here, this patient, what is also having, what is find here? There is some collection of mucus here. That is because of dryness. So if you don't take sufficient water, the mucus comes in the way, and every day you want to, you want to clear your throat. Something wrong in throat. What you are doing, most dangerous thing you are doing. That means you are doing, means every time the vocal start thrusting, tap, tap, like they beat each other like that. When you clear your throat. So there will be some roughness will start there, roughness. That once you go on singing with a rough voice, that becomes hard, forms a nodule. So in nodules also there are two types. One is called soft nodules. That is early stage of nodule. So when patient come to us, early stage, we will treat him by that voice therapy techniques. Where the singers will help us, the singing coaches like you. We have people like him, the speech therapist. First we will see the patient and then decide. The speech therapist, they will tell you the approach of the user voice. And singing coach, what she Kalpana telling in morning, the ways of singing, how to maintain everything, how to keep your posture. Posture is a lot of effect in voice. Posture. You should keep your abdomen perfect, straight, relax, because the breathing should come from the abdomen, not from the chest. And shoulders relax, make neck your relaxation, everything muscles relax. The postures. So in Europe and America, voice surgeons, sometimes they are called as theater doctors. Like so your sports doctors. Like a sport doctors, sometimes we are called as theater doctors. Suppose you are giving a performance, we'll go and watch you how you are doing. We'll watch you. So when somebody sing, because I will be singing TV, when there are music competitions, they are watching these singers. How they do all the fault, what doing wrong things they are doing. Just I will noting down. Sometimes you take pictures also, sometimes video also I will take them, so that I can tell to others. What the wrong things they are following that is observed by these voice doctors are. So then sometimes I ask my support popular singer comes to me. So I ask him to sing before me. So they start singing, then I will watch what are the postures, the difficulties he is showing, and what level this I think will be watching. So many things. The breathing pattern, how is holding breathing, at what level, and how the keeping the tightness of neck tension. We call muscle tension dysphonia. So keeping the neck tight or relax, everything. Facial grimaces, face, very. Your maneuvers can be seen on face when you are singing. I can see from your face, this I can tell. Is you singing properly or not? Your shoulders are keeping, your chest is moving or not properly. You relax your abdomen, everything. Your posture, when you're sitting in posture, when you should not bend like this, you should not bend like, because you can't breathe properly when you're singing. Posture very important. These are very important, you should observe. So these are all important. Improper way of using vocal nodules. Vocal polyps. Next, polyps mean nothing. See, there are blood vessels on the vocal cords. What will happen when you make just like Babaru, pichi pichi ka baadani. Oh, pichi pichi. The vessels will rupture at that time. The blood vessels start rupturing. So it gives you some hoarse voice. At the early stages, we can give voice rest, that will come down. For 10 days, 1 week, give total voice rest, it will come. If you don't you neglect that, that gets organized and forms a small mass. That is called polyp. Vascular polyp. That becomes small, like this, it will grow like that. That will grow and affect your voice. So, that should be removed. There is no medical treatment for vocal polyps. Vocal treatment. But I will tell you surprisingly now, I will show you next slides also. Now we can remove them without operation also. For example, I will tell you. I will tell you how to see them. Then, voice breaks. Singers will have. Breathy voice, loss of time, suddenly the voice choke. Because the breath support is not sufficient, what you are giving. You are not reaching high pitch, means breath support is not sufficient. The intensity should come from here, not anything here. So it's not poor breath support. One cause. Another thing is, sometimes if only one vocal cord is functioning, two vocal cords not functioning, only one vocal cord is functioning. So there is a big gap between the vocal cords. That fellow, voice will go like that. Voice will go like that. You know the city picture, Mayuri cinema. Guttunda? గొప్ప మహానుభావుడు విశ్వనాథ్ గారు చేసిన సినిమా ఒక్క కాళ్ళతో నృత్యం చేస్తున్న అమ్మాయి. సో నౌ యూ మేక్ పేషెంట్, నౌ అవర్ సింగర్స్, ఐ మేక్ దెమ్ టు స్పీక్ విత్ మోనోకల్ కార్డ్స్ ఆల్సో, వీఆర్ మేకింగ్ దెమ్. ఐ ఎమ్ డూయింగ్ లైక్ దట్. దే ఆర్ సింగింగ్ నౌ. వేర్ ది సైన్స్ హ్యాస్ డెవలప్డ్ సో మచ్. ఇఫ్ వన్ ఫంక్షన్ నాట్ ఫంక్షనింగ్, వన్ వోకల్ కార్డ్ స్పీకింగ్. చూపిస్తాను ఇప్పుడు మీకు. చూపిస్తాను సార్, వెయిట్. Loss of range, poor technique of singing, improper breathing, tickling, choking sensation. All the time do like this. What is the reason? Insufficient water intake. So if you don't take water, your throat becomes dry. So people say, sir, I take 2 liters, 3 liters of water. That not matter, because if you take 2 liters, next 1 hour it will go in urine. It will not be there in the body. Not absorbed. It is not maintained. Your throat is not wet. So please remember, singers, we must keep your throat all the time wet, not dry. Dryness is most dangerous for singers. Dehydration, very, very dangerous. Because I will tell you interesting aspect. The lubrication for the vocal cords is only water. Lubricant. అసలు ఇంకో విషయం చెప్తాను, మీరు ఆశ్చర్యపోతారు. vocal cords అంటే మామూలు కాదు. You know, the hardest muscle in the body, what is that muscle? Anybody can guess? Hardest muscle, sir? In the body. Hardest kaadu. Hard working muscle in the body. Exactly. Is correct. Heart. Because it will not stop. It will not stop. Similarly, as long as you are awake, you will be talking. Next to heart, vocal cord, vocalized muscle is the hardest muscle in the body. Because throughout whenever you awake, you will be talking. Sometimes some people talk in sleep also. So you cannot stop that. So that is the hardest working. Next to heart, vocal cords. So now you understand what is the importance of vocal cords. Next, I tell you, tickling sensation, GERD, that is gastroesophageal reflux. Acidity, the acid secretions also produce sensations. That produce constant clearing of throat, that sometimes becomes habitual. So when it becomes a habit, without your knowledge, go on clearing the throat. Spoil your vocal cords like anything. Next, pain in throat and neck. Singers will come, sir. It's all very painful, my neck, I cannot sing. Why? Why? Because you are using a faulty technique. You are keeping all the muscles in the neck strain, exposing to strain. You are abusing, you are not using the voice properly, you are beyond your levels of Shruti and other things you are doing. Beyond your capacity you are singing. So what happens, all these muscles become start aching. So your muscles become tough, and then when you start, the pain will start in the neck and the throat. So unfortunately what people are doing, they take some azithromycin, Swanta Vaijyam, Allamu, Mirial Tagatam. Actually, they are not essential, not necessary, no antibiotics. People think throat pain means infection, it is not infection. Please remember. This is worst thing done by singers. Unfortunately, in our country, whenever they get some pain in the throat, they go and take antibiotics. Antibiotics again will spoil the voice. Painkillers will spoil the voice. Your cold medicines will spoil the voice. If you take frequently cold medicines, that will produce dryness of the vocal cords. Spoil. So you cannot take medicines indiscriminately as you like if you are a singer. Please note this, very, very important. So these are the things I shown you, that vocal nodule. Now you can see, this is the one you can see the other video. See, watch, only one vocal cord is moving. See? The other vocal cord is not moving, see? So this is vocal cord paralysis. So this fellow has got vocal cord paralysis. So between the two vocal cords there is a gap, so you get breathy voice. The air is leaking through the vocal cord, so you get breathy voice. But we can correct this, no problem. They can become normal speech, go back. Nowadays, not a problem at all. You can correct it. So modern treatment methods, good counseling with voice changing techniques, computer voice therapy, singing techniques by singing coaches, phonosurgery, voice surgery, for making a voice a choice. For making a voice a choice. Now, care of professional voice. Singer should focus on singing tune. These things you know much better than me. You people, great professors are there. They know much better. This is only for completion I am taking. Understanding the concept of pitch, able to sing sustained notes, adherence to Shruti, ability to render gamakas with control, and mastering the speed, ability to traverse various octaves, correction of articulation of Sahitya. Because we are also trying to know all this Sahitya because we have to treat the patient, singers. So I started learning. Because my family is basically a music family. So they are musicians, they are singers, beautiful singers in my family. So I used to be a great member of my college orchestra in medical college. Whenever I was doing, I used to participate in all orchestra. I used to play harmonium, tabla. I used to play this piano, this now no Casio, mouth organ, all these things. Basically, that made me somehow a voice surgeon. So that is my ambition is, there are so many singers suffering from voice problem in the country. We have to help them. That is the reason. The shape of the mouth, the effective pronunciation of words. So how to keep their mouth open properly or not. So you cannot just sing just with the clenched mouth and half open mouth, not correct. Perfect, correct mouth opening, very important when you are singing. Okay? Control the volume, amplitude, background according to your background noise or your orchestra. That is very important. And also your theater surroundings, that acoustics also basically a lot of difference. So vowel pronunciation are very important features for imaginative power and improvise your voice. Singing voice therapy. This is very advancing treatment now even for the patients who are using now singing voice therapy to cut the voice disorders, voice problems. Designed to rehabilitate the patient's injured voice larynx, focusing and rebalancing the respiratory, phonatory, articulation, and resonance speech systems. Best results in experienced hands. Correction of fault singing techniques by experienced singing coaches, that is gurus, perfect gurus, singing coaches. They are the sole authority for this. Most important this is more important for amateur singers than classical singers. Classical singers, they have the gurus anyhow. But for amateur singers, they may not have proper guru. So most of them, they imitate and then sing. The voice becomes very worse, the problem will come. Vocal coaches can help singers to develop their singing voice further by learning harmony, vibrato, you increase the range and adding extra octaves, other things. Now, surgery, don't be afraid. Once I say surgery, all singers are very much frightened. Oh, sir, operation hodu sir. Unna gotu putneo sir. Unna gotu punte emal sir ma pani ma jeevitam enti. What happens if you operate on my vocal cords? What will happen? Now we develop techniques. Please remember, I can operate you while you are singing. Yes. Then what do you do? One singer has come and asked me, doctor, he has got a polyp, a big polyp is there, he cannot sing. And in olden days we are doing under general anesthesia only, that is very total anesthesia, put a tube, under microscope we are operating. So patient cannot sing if you give anesthesia, total anesthesia. Now this changed, everything changed. This is called office-based treatment. Office-based treatment, where I can pass a small light through your nose and pass the laser to that and remove that mass when the patient is just have this fun. I'll show you this one. This gentleman with volume bits above audio.
Okay.
See, his problem voice breaks. The voice breaks, very breathy, husky and hoarse voice, not able to reach the high pitch. That is the voice problem. So when we do the stroboscopy, so you find there is a mass in the vocal fold. So I had to remove that mass. The patient is not willing for operation. He is very much afraid. Then I asked him, sir, now voice suppose I lose my voice, what is my fate, sir? Okay, don't worry. I remove that when you are singing. Are you ready? That fellow frightened again. I will do this. It is painful. No, it is not painful. I will do it. You can happily sing. You sing, I remove that. Because this is the first surgery done in the world. I did the first operation in the world. This is called singing voice surgery. When I sent to these things, these what is that records? What records you call it? Guinness Book. They have sent an email, sir. This is beyond our level. This is beyond the level of Guinness Book. So we keep it reserved. We'll put it in the Guinness Book. That was the answer. I got a mail from them. Now you can see this patient has entered our operation theater, just lying on the couch. Just watch what there. He's singing on the operating table. Watch. See, on the monitor, I am seeing his vocal cords, and he's singing on the table. Did you see that? Watch. See, that is the mass. So, The instrument is going and patient is comfortable and he is saying all these things. So, that is the laser. So, the laser will remove the mass in 2 minutes. Yeah, and he will be. So, then I immediately asked to sing. Immediately. So, regional anesthesia, local. Just we give some spray, something like that, and then we do it. This is the most advanced technology called the epic vocal procedure. Done only in Hyderabad, in India, nowhere in India, only with us. People coming from different parts of the country for this very often, because the most safest. See, that is over. I removed that mask, and now ask the patient singing. See, your voice changed. Your voice changed. Then patient is telling, he started laughing. He started laughing. Sir, it's not believable. It is not believable for me. It's not believable. I said, no, you just wait. Let me finish. His joy beyond his bounds. He is so much happy with that.
Sir, I want to hear that.
This is after some time when the wound has healed, this operative wound. See, I will show that again.
I had voice problem and voice breaks when singing.
See, the mass has gone. Clear, vocal cords.
I had voice problem and voice breaks when singing for 5 years. After laser procedure, I have good voice and singing without any problem. Surprisingly, during laser procedure on my vocal cords, I am talking to doctor and also singing without any problem.
So, here you find somebody is asking, our Guru Vyasa sir, the Professor Vyasa is asking Balasubramanian Garu, one vocal cord, can they sing or speak, something like that. So, see, this is much wonderful, very surprising. I operating a patient, I open the neck, cut his neck. He is speaking, just watch. That see, this is, I had done so many patients who had a vocal cord paralysis. Actually, this operation is done for vocal cord paralysis. This is phonosurgery. Interesting aspect of phonosurgery, who cannot give general anesthesia because on the table you had to tune the voice like a radio, like your strings of piano or veena. How do you make your veena tune? Shruti, you fix some frequency, So I had to fix the frequency there. A boy has come with a high pitched female voice. I had to change to male voice. I brought to bring this high pitched to low pitched male voice. So he'll be talking while operating. See, this is a vocal cord paralysis. One cord is moving. You know this man? Maybe Shahid Babu. He is the brother of Manu. Manu's brother. He had, you know him, he had vocal cord paralysis, the Shahid Babu, because of the thyroid operation. We underwent a thyroid surgery. It happens in thyroid operations. So one or two vocal cords may be paralyzed after surgeries. That is one danger is there. So previously there are no solutions. By God's creation, now the science developed the voice surgery. We are now able to give them voice back. Even the last we can able to give the voice. That is the phonosurgery. So similarly it happened to him.
Can you count the numbers 1 to 10? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. What is the date today? Today is 25th October 2001.
See, his voice becomes so breathy, you cannot hear anything, you cannot understand. So, okay, I operated him in a workshop. This is after surgery.
I am Shahid Babu, residing at Hyderabad, sir. I work for a private company as assistant manager at Hyderabad. I am a professional voice singer. I lost my voice due to thyroid operation 1 year back. I underwent voice surgery by Dr. Phanindra Kumar at Guntur in the phono surgery workshop done at Guntur in October 2001.
2001 I operated him, 20 years before, not now. So I started working that day itself 2000. So so many people have benefited.
And I regained my voice after voice surgery by Professor Phanindra.
He's singing. I made him to sing in my workshop. There is a phonosurgery workshop in India. So I showed there are so many surgeons from Britain, America, people have come for the workshop. I showed them how we can make the people to sing and go back to their position. So this is called laryngeal framework surgery. We can change the voice in different tune the voice, and the laser procedures I have shown you how we can change the voice without operation laser. Now the other aspects of life for the people of singing. So this fellow, another problem.
I am Rajendra Kumar Namdev from Jagdalpur. I am staying at Hyderabad.
It have a female voice for a boy.
Post office at Jagdalpur.
My name is Rajendra Kumar.
After treatment.
I am from Jagdalpur. I am working as a clerk in post office. I am 30 years old. I was having the voice problem since last 17 years. Dr. V. Phanindra Kumar has cured me. Now I have a good voice. Dr. Phanindra Kumar gave me a new life.
New life. So, this is another case.
నా పేరు మురళీకృష్ణ. నేను ఏబిఎస్ఆర్టీసీలో కండక్టర్గా చేయించున్నాను. మాది పిడుగురాళ్ళ. నాకు వాయిస్ చిన్నప్పటి నుండి ప్రాబ్లంగా ఉన్నది. ఈ మాదిరిగా కీచు గొంతుగా వచ్చుచున్నది.
నా పేరు స్వయంపాకుల మురళీకృష్ణ. నేను ఏపీఎస్ఆర్టీసీలో కండక్టర్గా పని చేయుచున్నాను. మంచి స్వరాన్ని ఇచ్చి ఉన్నారు. ఆశ్చర్యకరమైనటువంటి విషయం ఏమిటంటే ఆపరేషన్ చేస్తున్నప్పుడు కొన్ని నిమిషాల్లోనే నేను మాట్లాడగలిగి గొంతు మార్పును గమనించి ఉన్నాను. నా జీవితం అంతా డాక్టర్ ఫణీంద్ర కుమార్ గారికి రుణపడి ఉంటాను.
I am 16 years old. My native place is Guntur. I have this voice problem since 18.
My name is Sita Nagalakshmi. I am studying junior inter in Guruvaya College. After this,
she is now computer engineer working in Pune. This girl. So many people are now they are doing they are benefited and they are very happy. So finally, I would like to do. I will finish fastly. So factors that influence the effective singing: flexibility of vocal mechanism, agility of the vocal cords, correct shape of the mouth and position of tongue, pronunciation, vocal range, appropriate loudness and volume to reach the audience. Creativity in musical phrases plays a very important role. The male and female built-up of voice producing organs are differs. So training style also should be differ. That is also you should keep in mind while training your students. And the factors that affect the voice: maintain good physical condition. That is very, very important for good tonal quality. Your physics and your mind also must be perfect. Maintain proper articulation, rate of speech, intonation, breathing patterns. Beware of external factors like air quality, humidity and noise where you are singing. One thing is speaker to listener's distance, that is harmonics, that is acoustics. Mic to mouth distance, that's also very important. Mic to mouth distance you perfectly maintain. Check for the hormonal changes, particularly thyroid. Thyroid can affect the vocal cords and voice changes can occur in thyroid. So you have to check the thyroid now and then. Avoid fatigue and stress, emotional instability. Don't be emotional and going for a program, and tomorrow I'm in a program, how can I sing, all these things, and you become so nervous, and your voice will not come. That the emotional instability should not be there. So age is not a factor. If provided you have a regular exercise on your voice, like athletes. Athletes, we are called them as vocal athletes. Vocal athletes. So do every day, do exercise and tone up the muscles of the vocal folds and the neck. So you can sing at any age group. It doesn't matter. But in some cases, it's possible the vocal cords getting atrophy. They become thin in some people. So we have methods where you can make them to vocal cord back to their position. We have some injections called fat injections, where suppose the vocal cord become very lax and like this, vocal cord flabby, like other members of the body, just to inject the fat into vocal cords and become very regain the strength and they can sing. Not a problem. I don't have time to show all these things to you. We have so many cases like that. That is called, sometimes we call senile larynx. The old people, the vocal cord becomes flabby like other parts of the body. Suppose a senior lawyer comes to me and asks me, sir, I'm not able to argue in the court because of this, my age, and I cannot. Okay, come, I'll do it. So inject the fat. In a local anesthesia like that, he'll be talking at the time also. And go. 1 hour, he'll go back and go back. So, so many advances are there, this is not a problem. So, that is called as a senile larynx, we call it senile larynx. Just though going to be correct. Okay? Regular warm-up is very important, please remember. Medications, don't use painkillers and anti-allergic drugs as you like. Don't do anything. Acoustics of auditory very important. Food and sleep. Avoid night late sleep because that increase reflex, chilies, masalas, late night sleep. Avakaya, all these things should stop. Maintain good hydration, that is very important. Singers, you have to sacrifice something sometimes for your voice. Warm up, train to sing wide intervals comfortably, correcting the vocal parts, effective breath control, flexible speech organs, and wider vocal range, controlling the volume, vocal pronunciation. These are also very important. Again, same thing, breath control, good hydration, good hearing, we must be there. People who want good singers, check your hearing. Because the feedback is very important for you. What you are singing, you must be here. And what level you are maintaining, Shruti, all these things, and your orchestra background, all these things, this is good hearing must be there. That very good hearing and learning capacity and ear training. Ear training, that's called ear training. You have to train yourselves. And we also practice ear training because when somebody is speaking and thinking, we'll just have ear training. We'll judge whether the ears is perfect or not, any breathy voice, what is the grades. We have grades in the voice also. We have grades all the scientifically, we have grades. We can grade the voice also. That is also there. So practice riyaz is very important. Maintain good physical and mental systems. Now, I will tell you singing is not only art but also science because I told you can just plot the singing here. So I can measure the singing voice, which is perfect or not. Okay, what this is called, this is voice spectrograms, where just like your ECG, how you see the heart, I can say your vocal cords function, which is perfect or not, I can see you. So voice training is an ongoing science. Vocalists must study the anatomy of the voice, understanding how they function in order to sing with the utmost splendor and success. There is much science involved in learning and all knowing the vocal music. A lot of complex mechanisms happening to our brain body to support the singing abilities. So when you are singing, your mind, your brain and body are working a lot. Not only the vocal cords. Please remember that. Not the vocal cords alone. The hormones are working. Your muscles are working. Your brain is working. So all these things must be synchronized. So understanding how you create sound and profound effects has a crucial in developing your own vocal art and using singing to advantage to improve overall well-being. Sarve jana sukino bhavantu. Thank you for your kind attention.
SwayamPrabha. Digital India. Educated India.